All right, ladies, we're going to have a serious conversation here. This is one that you know you've probably had with your girlfriends before, but we're going to do it on television today with some expert advice. You've had your children. You're not happy with the way that your breasts look, whether it be after breastfeeding or whatever it was. You're thinking, maybe I want to have a breast lift. Maybe it's time to get implants. Well, we're going to have that discussion today and find out if it might be the right choice for you and try to answer some of the most common questions with Dr. Jason Leedy, who's a plastic surgeon. It's good to have you here.
Nice to be here.
All right, I know that women have this conversation all the time. I've been a part of the conversations even though I haven't had children. Most of the women who come to you looking for breast lifts or breast augmentation, are they often women who have had children and they're just not happy with the shape of their breasts and how they've changed from a time when they were younger?
Oh, sure. That's the most common group of patients that's interested in the surgery. Having children and breastfeeding, that causes irreversible changes to the breast. And often people are left with loose skin that they didn't have before. The firmness of the breast has changed. They may have some sagginess, and so they look at their children. They think, okay, I'm finished having my family. I'd like to get back to the way that I was. And these surgeries, breast augmentation and breast lift surgery, can do that. But there's other patients that are interested in the surgery as well. Any patient that is dissatisfied with their breast shape. Sometimes women have significant asymmetries, and breast augmentation and lift surgery can help correct that. And other time, just the aging process results in volume loss of the breast and additional droopiness, and these surgeries can help.
Let's talk about the comparison between a breast augmentation, which we all know that you're getting breast implants, and a breast lift. Why would you, I mean, it's obvious kind of what one does, and the lift alone seems to imply what the other one does, but explain really what a woman will achieve through each surgery.
The augmentation surgery will make the breast larger, of course. It also will improve the breast firmness, and in women with a small amount of droopiness to the breast, an implant will give the appearance that the breast has been lifted somewhat. And now that's just for a small amount. A lot of women, though, they have a significant amount of extra skin. And that extra skin can only be addressed by removal of it, and that's where a lift comes into play. And a lift will really, the bottom line is the position of the areola on the breast mound. If it's low, a lift is the only way to correct that. If it's not low, then an augmentation alone can make a nice improvement. So it really comes down to a patient's personal aesthetics, what they'd like to see at the conclusion, whether or not they need a lift. And after discussion with the patient and coming up with what they'd like to see with the surgery, then a lift can be recommended or not.
A lot of women who are having babies, it's very important to them to breastfeed. If you have breast augmentation, does that change that? For a woman, can she still breastfeed?
Yes, yes. In general, they can. There are certainly some irreversible changes that occur with breast augmentation surgery. And one of the issues that can happen is that there can be diminished nipple sensation, and that can be a major issue. But the ability to lactate, to nurse, that is generally preserved. Okay.
And how do you perform the surgery? I know there are different ways that the implants are put into behind the skin, so that sometimes there's an insert underneath or go through the nipple. What do you prefer to do?
Well, I educate the patient on the different options, because breast augmentation surgery is all about options. You have the option with the size of the implant, you have the option with location of the implant and incision. My preferred approach is an incision in the breast fold. For most of my patients, that works out, that's the nicest way, because the fold is a hidden area anyhow. Most women have to lift the breast to actually see the fold. So that's a nice place for the incision. It provides the most direct access to developing the implant pocket, the most precise implant placement. So an incision in the fold, and then generally underneath the muscle. Underneath the muscle tends to make the upper pole of the breast more natural, a more gentle slope. It minimizes the risk of capsular contracture over the long term. It also makes mammograms easier later on. And then,
when you say underneath the muscle, though, that sounds like it can be more painful.
Actually, no. The recovery for the surgery is generally within days. When we're talking 24 hours, someone is back to near normal activity. I don't allow my patients to get back to exercise until they're 1 month out, but as far as driving, as far as showering, they can do all that within 24 hours.
And when you talk about the incision, like, I mean, how long is the incision, and does it depend on the size of the implant?
Well, it depends on the type of implant. There's two major types. There's saline implants and silicone implants.
What do you use?
Well, I use both,
Okay.
and they're both are FDA approved, both are safe. They have different indications, and they're not for everybody. I mean, a saline implant is nice in the sense that it's a slightly smaller incision, about 3.5 centimeters in the breast fold. It is easy to monitor if the implant were to rupture. But it tends to have a slightly firmer feel than a silicone implant, and a lot of patients will say that they feel that the silicone implants have a more natural feel, and so women do choose that type of implant often. The problem with that implant, or the difference, is that it comes pre-filled, and so to place that implant, it requires a slightly larger incision. So that's why the incision in the breast fold often allows placement of the silicone implant easier than other access incisions, because depending on the size, it could be 4.5, 5 centimeters for the incision, and in the fold then is the only place to do that through.
How often do implants have to be replaced?
That's a very common question, and some patients have a feeling that from what they've read online, they think every 10 years they need to get it changed, and that's just not true. The studies show that up to 25% of women will need some sort of revision within 10 years or so of their surgery. Everyone needs to know that they are not lifetime devices. They are not permanent devices. There will be something likely that needs to be done at some point in their life. But the reason to do that is if there's a problem, if their aesthetics change, or the breast change is due to pregnancy, weight changes, menopause, etc. So if the patient decides they want to be bigger or smaller, well, that's a reason to change. Or if they develop a capsule, then they would need to have it changed too. Or if it leaks.
Are they pretty sturdy? I mean,
yeah.
If you, let's just say, you're playing basketball and something smacks you right in your chest real hard.
Yeah.
It's not going to pop?
No, it's not going to pop. I mean, it would take a significant force. It would have to be like in a car accident or something like that. You know, it's not, they're very durable.
Okay.
They just don't pop.
Okay, good.
Yeah.
And a breast lift, then, and that whole process, that's going to take how long, and what's the recovery on a breast lift?
Well, breast lift's a longer surgery because there's more incisions, and because there's more incisions, there's a longer recovery. So you're usually talking a few weeks for recovery. That at least more like a week and a half until someone is feeling back to normal, and they may need up to 2 weeks depending on the extent of the lift that's necessary in order to get back to work. The surgery, though, depends, the length of the surgery depends on the amount of lift that we're doing. Sometimes just a small amount of skin can be removed around the areola. Sometimes an anchor type incision that's used in a breast reduction is necessary, and that may take up to 3 hours then to do that kind of surgery.
Okay, well, there's so many questions that people have. I mean, it really is a popular topic for women to talk about. So if you have any questions, we haven't answered something here today, give Dr. Jason Leedy a call over at Cleveland Plastic Surgery Institute. The number there is 440-461-6100, or you can log on to drleedy.com. It's a big decision, and certainly worth doing some investigating and talk to the doctor, because I'm sure he'll answer any of your questions. Thank you very much for being here.
Thanks for having me.
And now we're going to send it over to Michael.